Welcome back to Lifeline, the show where we improve our lives by feeding our minds. So far in this series, we've explored the basics of head and neck cancer, its diagnosis process, and treatments. In this last episode, we shift our focus to survivorship or the journey of rebuilding life after treatments and embracing new beginnings. So, stay tuned because later on, we will be joined by our skillful doctors from UST Hospital to help shed light on this topic. I am Chelsea Rushana. Here to answer our questions on supportive care is Dr. Bacoro. So, thank you so much po for joining us today, Dr. Bacoro. Matanong lang po namin, could you give us a short explanation po of what palliative or supportive care is? And how does it relate po ba to the life after treatment for head and neck cancer patients?
Okay, thank you for the question. Again, I'm Dr. Madonna Bacoro, a palliative specialist in UST Hospital under the Department of Family and Community Medicine. So, actually, our role here is in the context of universal health care, no? So, through that, nakapasok nga yung palliative care na context sa primary palliative care under family medicine. And so, ang ibig sabihin is biopsychosocial provisions, yung assist nila sa comfort of life care, no, na they help the palliative specialist, which is ako nga yung gumagawa ngayon na sa family medicine collaboration, no. So in the context ng MDT, multidisciplinary team, we provide the support to the patient, family, and community, no. So initially kasi meron ng existing talaga na palliative care naman dito sa UST. However, meron ng innovation sa recently, no 2023 through a capstone na nag-introduce ng multidisciplinary context at the same time with the primary palliative care provisions ng family medicine. So, palliative subspecialty, primary palliative care magkasama with the multidisciplinary team, and of course yung accessory na community, no, linkage, yung compassionate community. So upon referral kasi ng head and neck, no, we attend the multidisciplinary team or tumor boards, no. So syempre lahat ng different disciplines may iba-ibang ways to cater palliative care concept sa isang patient, no? So, hindi tayo dapat malito doon. Merong palliative intent, merong quality of life care na kami na. So, upon informed consent, ibig sabihin na discuss sa tumor boards ng iba't ibang specialty, yung best interest ng patient, we lay out kung ano yung possible choices ng patient, no? So, after that, doon sa informed consent, yung establishment ng goals of care, wherein kung sinabi nila na agresibo pa rin, kasi iba-iba personality ng tao. Sometimes, we want active treatment pa rin, and the others supportive depending on the stage of illness they are in. But of course, sa gitna, kung major therapeutic efforts, that's a lot of things pa to do, pwede sa radiotherapy, sa ENT, ganyan. So, we provide supportive care naman, no? And then, after that, yung advanced care planning, and advanced care directives, and of course, anticipatory care guidance, yun. And so, yung process ng facilitation would be already a great help sa head and neck na team ng BCI.
Thank you so much po for sharing all of those insights. Very comprehensive po, and talagang nararamdaman namin na yung biopsychosocial aspect po for the patients is talagang napapahalagahan with family medicine.
Yes.
So, thank you so much.
Thank you.
Can you give a short explanation of what speech language pathology is and how it relates to life after treatment for head and neck cancer patients and their families?
So speech language pathology is a discipline wherein we work with individuals who are suffering with communication disorders. So they're having problems in terms of talking and connecting with other people. So there are a lot of ways where people might have problems communicating. So they might have problems with their voice. They might have problems with moving their structures and producing sounds. There might have problems getting words out or understanding people. But aside from that, we also work with individuals who have problems swallowing in terms of feeding, because the structures that we usually use for speech are the same structures we use for swallowing. So after head and neck management, cancer management, we work with the entire team in order to get their lives back in terms of communication. So we want to give them the rehabilitation that they need in order for them to have functional communication back. So it might be working with their voice. So we want them to improve the quality of their voice. It might not be going back to the way it used to be, but we want functional voice for them. We want them to have clearer speech, ability to talk. Sometimes because of procedures, they would have difficulties in terms of moving their structures or producing some sounds. That's where we are helping them with. And then, of course, we want to improve the way they swallow as well. Sometimes one of the things that are problematic after the intervention is that they affected the way they swallow is affected as well. So that's why we provide them with intervention to help them recover from that.
Here to tell us more about the dental aspect of things is Dr. Sandy Uy. So thank you so much po for joining us today, Doc. So could you give us a quick explanation lang po of how dental care helps with a head and neck cancer patient's life after treatment?
Okay, after treatment or
Could be during, how it
and
assists.
before. Actually, we are there before, during, and after. So, but if you look at it at the whole perspective, ano lang kami? Ang dental care would be parang supporting cast lang. Yeah. Andyan yung mga main characters natin, radiation oncologist, surgical oncologist, medical oncologist. Sila yung talagang main doon. But somehow we support them during the course of treatment. So yung tanong na before, ang dental care, if you think of it, para siyang ano lang, di ba, for the teeth lang, ganyan. Pero it somehow helps or supports patients who have cancer, specifically head and neck cancer. Actually, hindi lang head and neck, the entire body na rin. Before, like for example, a patient is diagnosed with cancer, patients are sent to us for clearance. Ano yung reason for the clearance is because we want to make sure that there are no focus of infection na pinagmumulan. Wala tayong dental problem na may cause infection in the future. Why? Because yung treatment na gagawin, they are going to give chemotherapeutic drug, or the patient will have to undergo surgery, or the patient will have to go radiation therapy. It does have some effect on some patients, parang complications. So, in order to prevent that complication from happening, we want to be sure that there are no infection that will be that can happen in the future. Tapos yung during naman, we also support in fabrication of mga appliances that would make it easier for the patient and also for example na lang yung mga stent like this one. So the patient would be wearing this during the treatment during radiation para for example yung target niya would be in this, for example ito yung tumor, yung target niya dyan. But meron pang other structures that would be in front of it or at the back of it that can be hit by the radiation. So ang goal namin is to medyo i-swerve siya para ito lang yung tamaan. So there will be less complications. Tapos yung aftercare naman, syempre, everything has to be followed up. Ganun naman yan eh. So we have to make sure that the treatment that we're done, we have to maintain its health. So frequent follow-up. Generally, the procedures that we do or during examination, during treatment would be almost similar din naman sa usual namin routine. Yun nga lang, may special considerations with cancer patients.
Oh, I see. So, thank you so much po for sharing that with us po, Doc Sandy.
So, I'll be undergoing radiation treatment for my actinic cell carcinoma, and I was referred kay Dr. Sandy for yung sa dental kasi this would help me yung to minimize yung risk or side effects ng radiation. So, Dr. Sandy check yung condition nung teeth ko, and I was recommended nga for the extraction ng wisdom tooth. So, very comfortable ako kay Dr. Sandy kasi he was able to explain to me everything about dun sa dental concern. And ramdam ko rin yung sincere concern niya for his patient. So, very smooth lang yung naging treatment ko for the extraction, and yun, mas kampante ako ngayon for the radiation.
Here to give us more information on the nutrition aspect is Miss Maui. So, Miss Maui, could you give us a short explanation po ba of what the scope of the nutrition covers and how it helps po sa mga patients po na may head and neck cancer right after treatment?
Okay. So for the scope of nutrition, so first and foremost, we need to assess our patients, no, those who had just undergone their treatments, no, to know their nutrition status, yung baseline natin. And then from that, no, we do actually assessment not only of their body mass measurements but also of their food intake and any symptoms na might affect their eating. Kasi our goal no, sa nutrition is that we could siyempre make sure that after treatment, they'll be able to have adequate nutrition para, kumbaga, to boost their recovery, make sure that they have a strong immune function, and somehow to prevent also recurrence, no? And though ang pinakatalagang goal ng nutrition is that we want them to be, to have adequate nutrition para walang malnutrition. For one, no, yung mga patients natin after treatment, may mga side effects yan, no? Like most of our patients, we notice na parang meron silang mga dry mouth, no? They have mouth sores, they have difficulty chewing and swallowing, merong loss of appetite, and all of these can affect their food intake. Yun, so maraming challenges to eating. So unang-una, we assess them and we try to address whatever eating problems they have, no? And give them individualized meal plan or give them recommendations. We teach their relatives, their family, ano pang magandang i-prepare na food for them, no, to somehow address their symptoms at makakain sila ng maayos. So yun yung pinaka-scope ng nutrition. So again, kailangan na we make sure that our patients after treatment, no, can still they regain their strength, they will recover, and then maging maayos na yung kanilang pamumuhay afterwards.
So, thank you so much for that
Yes.
overview po, Miss Maui.
Okay, thank you.
Miss Maui, could you give us
Yes.
a quick tour around dito sa may Nutrition and Dietetics Department niyo po?
Oh, sure, no problem. O sige,
By the
ito
way
muna. Ito muna. So dito yung tatawag namin nutrition clinic. So basically, dito nangyayari yung aming nutrition assessment. That's we have our weighing scale here, no? And we also have mga food models namin and instructional materials, basically. So, kung matuturo kami ng patients, we need to assess them. Dito yon nangyayari. This is called nutrition clinic. Yan. So, after that, try dito. We also have our dietary office. So, medyo ito yung busy area. Papasok ka kasi medyo Ayan. Ito naman yung aming dietary office. Ayan. So, dito naman nangyari yung mga calls, no? Transactions, yung mga calls namin to our different wards for their diet ng ating mga pasyente. So, ayan. Maraming So, mga dietitians natin are also here doing their clerical works. Dito. Okay. And next, ayan. So, pag siyempre may diet na tayo, pag may diet na yung pasyente namin, no, now we have to prepare them. That's why we have this. Meron kaming kitchen dito. No? Ayan. So, yung kitchen naman, no, pasok tayo, okay lang, mabilis lang. Ayan. So, siyempre, ayan, saan niluluto yung mga pagkain ng aming mga pasyente. Ayan, yan. So, we have our cooks here, some of our food service workers doing the job.
I see.
Okay. Ayan. Ito naman, storage area lang naman namin yan. Siyempre, may mga stocks kami. Okay. Sige. Next, we go to our okay. Yung mga ihaw. Ayan. Dito naman, we have here our tray line or dishing out area. So, each patient kasi will receive individual trays. So, dito yung piniprepare. Yan, during breakfast, meron tayong breakfast tray line, lunch, and then dinner. Yan. So, ngayon, wala na kasing preparation kasi we just delivered the lunch for our patients. And just in case, syempre, hindi maiwasan, there are patients na hindi nakakain ng maayos, no? They may have challenges ng oral feeding, so they are given or prescribed tube feeding naman. So for that, tube feeding, dito naman siya, hiwalay yung preparation niyan. So we have this tube feeding area na dito ginagawa lahat ng, yun. So may mga milk formulas na dyan na design, na individualized din yan para sa iba't ibang patients natin. So, yeah. So that's basically dietary, no? Yun naman yung
That's the gist of it naman.
Yes. So, talaga naman ang main job talaga, ang main purpose naman ng department namin is again to provide meals to our patients. And yun, yung ating nutrition education, nutrition counseling, doon na yun sa nutrition team.
Formally close this episode and mini-series, on behalf of all the doctors of the UST Hospital and staff here on Lifeline, we would like to say thank you for joining us on this journey. We hope you learned a lot and enjoyed this format of episodes. We would also like to extend our gratitude to all of the doctors from UST Hospital for helping us bring this production to life. Once again, I am Chelsea Rushana and this is Lifeline, the show where we improve our lives by feeding our minds.